All right, we are back again, a clinical conversation today with Matt Lorimer, who is a clinic manager and physical therapist at CORA. We have Ashley Langford again, Director of Clinical Excellence at CORA, both very handsome men and great golfers. I am Adam. I am the marketing guy at CORA. And today we're talking again about golf and physical therapy. And this conversation might be a little bit more geared towards the clinician. However, if you are just a golfer and you want to know more about golf and physical therapy and how the physical therapist can improve the golf game, this is also going to be a conversation for you. But we're going to kick things off by talking a little bit about common injuries, maybe just like the top 3 or 4 common injuries that you see as a physical therapist who treats golfers. Matt, what do you got?
Yes, I mean, in terms of the most kind of common golf injuries for, if we're talking about the amateur golfer, primarily the big two are low back pain and elbow issues. So either tennis elbow or golfer's elbow.
And if I come in, if I have the back pain from golf, how important is it for me to tell you, hey, I have back pain, but it's from golf, as opposed to just saying like, my back hurts. It could be from golf. It might not be from golf. Does it help your treatment strategy? Does it make your treatment strategy different by telling you that I either play golf, I could have got injured by golf, or I need to fix my back because I want to play golf?
Yeah. So, I mean, in terms of, when we're doing the subjective as a therapist, we want to know as much information as possible. So, if we have the knowledge that the patient is a golfer and, that is their goal is to get back to playing golf again, then, that allows us to kind of set out a treatment plan with goals which are more kind of targeted to that level, as opposed to, maybe you're kind of someone geriatric that comes in with just generalized low back pain. The kind of rehab and the goal setting is going to be different compared to someone which is trying to get back to playing a sport at a kind of higher level. So yeah, I mean, it's very important that we get as much information as possible from the patient when they come in for the assessment.
And
I
if I'm
will.
go ahead.
Well, I was just going to say something that I find interesting as a PT nerd is the fact that with golf, what's interesting is our lumbar spine, our low back, it really the way the shape of the vertebra are set up, it doesn't really set up for any rotation, very little. And our thoracic spine, our mid back, sets up for loads. So, what's interesting for golfers that I always think about is, for those that are getting in and swinging hard and they're having potentially kind of like that low back pain that maybe is coming from that transition between thoracic and lumbar. Just the mechanics from T11 to L1, it goes from freedom of rotation to nothing. So to me, I find that's a common area to wear down and see chronic issues. And another kind of nerd element too is on the positive side with golf and the swing, the golf swing itself is amazing for rib mobility. Although we talk about the rotation of the thoracic spine, your ribs are generally fairly stiff, particularly if we're not, stretching and moving through full functional patterns most days. As time goes on, they stiffen. The golf swing's great for that. So in terms of mobility there, it's that would be kind of an area I'd go to. And obviously hip flexibility. Matt, you probably would agree here, the amount of young people that you go and stretch and they might be 20 years old and they've got, they're missing about a third of the hip mobility that you'd expect. That takes a toll.
Yeah.
So
Yeah, it's kind of, the world we live in now, a lot of jobs are sedentary, So you have someone who's sitting at a desk, 8, 9 hours a day, and then they want to get out and they want to, weekend warrior, they want to play golf for the weekend, but you're dealing with that 5 days of consecutive sitting at a desk, where the hips are really tight and we have that anterior pelvic tilt, and then that's now, predisposing the low back to more stress. So yeah, and as you said, even people at a much younger age, are still missing that hip mobility. So it's something we need to be very conscious of to assess as part of the assessment and make sure we're providing the appropriate exercises and activities to get them back to playing pain free and playing with potentially better biomechanics.
So that's a good lead into if I'm new clinician, any clinician that really doesn't know much about golf, but I obviously know about hip mobility, back pain, all the things that you guys are talking about. How much of the sport do I need to know, or what do I need to know? How can we help people understand this is all you need to know, or these are some of the key points that you need to know about golfers in order to treat them well, better?
Yeah. So I mean, I would say, when we're assessing the golfer, first and foremost, we want to look at the player or the patient from a holistic approach. So we're looking at all the different aspects of what's going on in their life. Their sleep quality, their nutrition, their hydration, the physical status. So we're getting a kind of clear, wider picture. But then kind of delving into golf specifically, golf is a sport that it is very specific in terms of the movement which is being produced, that rotational swing. So like any other sport, I think as a therapist, if you want to rehab someone to, a very good level for their sport, it's something that, ideally you potentially played the sport when you were younger, or it's something that you have done, a little bit more external training in to be able to kind of hit all the kind of key points we're looking for during the assessment.
Yeah, you got to, if you're getting into it, I would say, from what you're saying, personal experience in the sport's huge, because then you can really appreciate the fact that, depending on where you are in the swing, the demands of certain parts of the body, because for someone who hasn't played, they might watch a swing and think it looks fairly symmetrical, but the reality is, you can start to instantly pick up on, okay, well, I need to check the shoulder for this range of motion because of this part of the swing, and the hip for this one, depending on where they swing. So even without going into the detailed, specific training for golf, knowing the swing, experiencing the swing, and then breaking down, okay, where would the right shoulder be for a right-handed golfer during this part of the swing? Like, where's the most impact going to come from? That's huge.
Well, and I know Titleist does it's like a TPI certification, right? Which is kind of like an FMS of golf. Does that translate to a treatment strategy, or is there like a clinical TPI that you have to be a physical therapist or somebody, with a healthcare license in order to do that particular test?
Yeah, so I believe for the TPI, you either need to be a physical therapist or I believe personal trainers can also do the TPI certification.
Yeah.
Again, it is something, that is, kind of considered the gold standard for, people that are working in golf, and you're potentially working with professional players, is to be TPI certified. And I think it is something that, would definitely help with your functional movement analysis of the swing, and certain things to look for during the assessment, to kind of target on specifically for the golf swing. So I would say it's something which is, maybe not for the novice that's kind of getting into golf, but maybe for someone that's a little bit more kind of competent and been treating golfers for a while, and you want to kind of take things to the next level, then the TPI certification would definitely be beneficial.
What about the novice then? What should they do?
I mean, I would do some research into golf. I would look at, what sort of research articles do we have, kind of within the last 5 years that are exploring different injuries and the causes of injuries. So anybody can do that, as a student, as a new graduate, you can do your own research, and you can find out a lot of very, very beneficial information that you can apply when you start treating. That being said as well, there are other golf rehab courses that are on the market as well. Myself, I'm going to be what's the word I'm looking for? Leading a golfer rehab course through CORA next year. As I said, for someone that's maybe just kind of looking to delve into golf a little bit, more of a novice that's never really played the game, the course that I'm going to deliver is going to focus on, kind of breaking down golf from, the origins of the sport to, what's required in the golf swing, practicing the golf swing, as well as maybe looking at video analysis, so we can start to pick up swing faults. And then from there, kind of looking at, the biomechanical aspects, the common injuries, and how we can work on rehabbing these players.
Yeah, Matt's course, TPI, and there is a functional movement golf, might be through the Gray Institute as well. But I think at the end of the day, having a structure, a system that you use to analyze movement patterns is key, right? So that's something that Matt had to develop, and it makes it more consistent, makes it quicker and easier for a clinician. So anyone looking to dive into it, I would say find a course or a certification that offers a process that you can then come out of and utilize on any golfer that comes in. It makes it quick, efficient, and you can really kind of grow from there.
Okay, here's one. This is kind of like, for your reaction. I took a course a long time ago. I think it was through the running clinic, and the instructor he kind of like hit on something that was very interesting. The whole course was kind of centered around the fact that for runners, right? Everybody, if you're analyzing a runner's gait and that person is maybe pronating, or they have a foot that's kind of sweeping a little bit, or the hip and knees don't perfectly align, or they're a little asymmetrical in their trunk rotation, all these little abnormalities, if you will, or asymmetries. He said, don't try to fix those people because they have been doing this forever. And then he would roll film on these different marathon like winners who had to run 26 miles to school in, the heat of the summer, carrying a book bag. And that's why they run like this, because they were trained running a book with a book bag in their arms, right? So all these different things. So when you are looking at if you're analyzing a golfer's swing, how much of it are, when you're talking about functional movement patterns and, asymmetries, and how much of it are you trying to correct from the perfect golf swing versus just, this is the way the person swings, but let's just make sure they're doing it in a safe and effective way. They're building on what their strengths and weaknesses are, not to, again, try to take them out of the patterns that they've built over time, they've evolved into, but to do it safely in a way that's still going to help their performance. I don't even know if that was a well-delivered question.
No, I can't help but think, if I'm thinking of the right person, is it Jim Furyk that used to have that?
He has like a sweep, yeah.
Yeah, that's exactly what I was thinking. Actually, Jim Furyk's a perfect example, that he had a very abnormal swing where he was swinging on a kind of outside pattern, and then he was waggling the club above his head before he came down for the follow through. And that's something that, it's not a typical golf swing. It's not something that when you're teaching golf that, that would be taught. So that's something that he developed over time for whatever reason, but it seemed to work for him. And I think that's where, we kind of have to differentiate between, the physical therapist and the golf pro. It's the golf pro that's delivering golf lessons. It's their job to kind of work on that swing analysis and how can we improve the swing from an actual technical standpoint. Whereas when we're looking at the swing, we're maybe going to pick up some little faults here and there that we can say, okay, this is potentially happening because we lack the thoracic mobility, or we lack the hip mobility in the leading leg. So we're kind of looking at it from more of a physical standpoint. We've identified that fault. This is why we think it's happening, and this is what we're going to focus on. But we're not really trying to, really correct the patient's swing in terms of the technique.
So those are probably some pretty good partners to have, I imagine, in the industry, the local pros. If you are trying to become kind of like the niche, or make this your niche, if you're trying to become the golf PT in your community, I would say hooking up with a lot of the pros is probably a good start.
That was such a great question, though, Adam. Obviously, like you mentioned, the runner, and we want to keep it golf focused. But for depending on, like, from a PT perspective, if there's pain involved with the swing, correct me if I'm wrong here, Matt, but like I would be thinking that's where you've got to test retest during your evaluation, right? Like what reproduces the pain, and then how does that tie to the golf swing? And Matt, obviously you could speak to testing that you use as well, specific to golf. But I do think to generally answer that really good question, without getting too deep, it's our responsibility as professionals to identify what is high priority that needs to be corrected versus maybe doesn't really matter as much. And we do, from an evidence-informed perspective, we are aware that like posture and the movement mechanics don't directly correlate to pain. So just because we see someone with some type of abnormality in the swing, Matt might have to do a test retest. If closing down on that side of the back reproduces pain and that's what he's seeing, then yeah, that needs to be addressed, and that might be a conversation with the pro as well. But correct me if I'm wrong there, Matt.
No, 100%. Actually, I said it's if there's pain involved, then we're looking to obviously recreate that pain on the assessment, and we can test particular muscles. If it's contractile, if it's not contractile, then we're looking at non-contractile structures. And then we can basically take that back to the golf swing, and we can see from the swing, if there is a potential segment of the swing where they feel the pain, then from there we can potentially analyze, okay, this is what we think is happening at this particular point, and then we can break it down in terms of where we would go for in terms of treatment from there.
All right, well, I think we might pause here because now that you've told us that you're building a course for next year, we want to save some conversation to talk about that. But is there anything else kind of in closing that you would share, again, with PTs that are new to treating golfers, but definitely would need to know what they need to know? Anything else that you would like to share about that?
Yeah, I mean, just overall, I said if it's something that you want to get into, like a niche market, you want to do your research, and I said even students or new grads, there's a hell of a lot of information out there on the internet, that we can find, up to date evidence-based articles. We can see, okay, these are the most common golf injuries. These are the likely reasons why they occur. And then, from there we can start to develop our knowledge. That being said as well, if you do want to work in a particular sport, I would definitely recommend some sort of external education course, where you have someone that has, a lot more knowledge in the area that can then help you basically figure out the specific areas that you're going to target when you're assessing golfers. So whether that's the TPI or the course through CORA or the other course that Ashley recommended earlier, I said we maybe choose one of them. We do the education, and then that gives us a kind of a better scope when we're going in to assess these players.
Ashley, anything to add?
The only thing I'll add to it is, heavily recommend make sure the relationships are there with the pros at the clubs. And I mean, Matt spoke to it earlier. That's the magic there. If you have the relationship with the team, then you are set up to treat the patients perfectly. So,
okay, I have an important question in closing. Matt, would you rather never 3-putt again, only 1 and 2 putts, or hit every fairway off the tee?
Oh, it would have to be every fairway because my driving at the moment is atrocious.
All right, Ashley, what would you rather?
I'd be happy for either card, man. I mean,
all right, Matt, thank you very much. Ashley, thank you very much. We will see you guys on the in the next conversation.